Hi, is your wrist really sore and you're wondering, is it carpal tunnel? Is it arthritis? How do you get rid of this wrist pain? Well, stick around because I'm going to answer those questions so you can figure out not only what's causing your wrist pain, but the absolute best way to treat it. If we haven't met before, I'm Dr. Laina. I'm a chiropractor who's been practicing over 30 years, and we see an enormous number of people coming into our office with wrist pain. Stick around to the end of the video because I'm actually going to show you my absolute favorite brace that we recommend to all our patients. It's not very expensive and it's really helping take care of their symptoms. Let's start off with carpal tunnel. So many people are told that they have carpal tunnel syndrome, and the truth is this is the most overdiagnosed thing we see in our office. Everybody with wrist pain is told it's carpal tunnel, and that's actually fairly rare. So what is carpal tunnel syndrome? Carpal tunnel syndrome is caused by inflammation in the wrist. So you have a sheath that goes over your wrist, and all of the nerves and the tendons travel under it into the hand. And sometimes, whether it's because you're pregnant or you're inflamed for any other reason, it'll cause too much pressure within this sheath and it'll pinch on the nerves. And the most common things that you'll experience when that happens is more of a tingling in the fingers, the thumb and the first few fingers. And also you might notice a burning, or you just might notice that it's weak. So those are really classic signs that the nerve going through the sheath is being compressed. But that's not what's causing most wrist pain. Most wrist pain is actually caused by an overuse issue, meaning that we're using our wrists, our shoulders, our elbows, and even our neck in the wrong position for hours and hours and hours on end. And that may result in anything from tendinitis to arthritic issues, and also just general overuse issues where you're going to get sore from using the joint too much. The most common cause of that actually doesn't stem from the wrist, but the wrist is intricately connected to your neck, to your shoulder, and to your elbow. When we talk about the neck, the nerves from the neck actually control all of the feeling into your hands, the muscles of your forearm, and the muscles of your wrists. So if they're being pinched, they may cause symptoms to go down the arm and into the wrists. By the same token, if you've got tension in your neck, or if your shoulders are locked forward, or you have a problem with your elbow, that's too going to cause pulling somewhere along this whole chain. And very often that's going to result in a weak feeling in your wrist or any kind of tension in your wrist. So the most common symptoms we see when you're dealing with more of a tendinitis or a chronic overuse issue in your wrists is that people will tell us they have trouble getting into yoga poses, or they have trouble lifting things with their wrists. It's just getting very, very achy to twist. Sometimes people will complain of that. And they're also going to feel quite a bit of tenderness when they feel in through their wrists. And that generally is not caused by a carpal tunnel syndrome. So how do you treat both of these things? Well, if you have a true carpal tunnel syndrome, you really want to focus on inflammation, bringing down inflammation in your body. So if you have it because you're pregnant, I would say fast forward to the end of the video and notice what our absolute favorite brace is, because that's going to give you a lot of relief. But if you're not pregnant, you're just dealing with regular inflammation, I would really encourage you to take a look at what you're eating to make sure you're not eating inflammatory foods, and talk to your healthcare provider about some supplements that may bring down your inflammation. Things like turmeric and omega-3s that are quite anti-inflammatory. In our office, we never move to anti-inflammatory medications right away. We really want to reduce the amount of medication that we're loading into our body and get to the source of the issue instead. Another thing that works really well for carpal tunnel syndrome is to put something cool on your wrist and to just make sure that we're trying to keep our wrists as aligned as possible when we're working at our desks. So what to do if you think you may be suffering from, maybe it's your neck causing your wrist or your wrist causing your elbow, you're not sure where to begin. So I'm going to give you a few things to try to help you isolate what areas may be contributing to this wrist pain. So the first thing is to really just take a note whether you've got some achiness in this side of your neck, and or whether the range of motion is not as great on one side of your neck as the other, or you feel any kind of pinching feeling. And you can really just tell that very often just by moving your neck back and forth, taking your head from side to side, and noticing if the same arm that you have wrist pain, if you're feeling tension on that side of your neck. Another one that's really common that seems to be affecting a lot of people's wrists is when the ribs and the shoulder blade area get tense from sitting forward like this. People will sometimes experience pain behind their shoulder blade. And the way you can tell whether your shoulders are starting to come too forward is simply to take one of your arms and just place it, if you can, gently behind your back. And just again, compare side to side and notice if that side you're having wrist pain is also having a hard time opening up when you put your arm behind your back. The next area that you can check is your elbow. And this is really one of the most common things that we see in our office is that an issue with the elbow, because of the way the tendons come through the wrist, is causing a great deal of wrist pain. So one of the really easiest ways to figure out if you're starting to develop a tendinitis or a tennis elbow or a golfer's elbow is simply to turn your palm up and then go just below the elbow, the eye of the elbow, into these fleshy parts here and dig your thumb into them. So right in through this area and right in through this area, and just sort of feel around in there. You can go right up to the level of the elbow. And if it's really, really sore, you may be suffering actually from a tendinitis in the elbow from overuse that's leading to wrist pain. And then as promised, let me show you our absolute favorite wrist brace. So both myself and my husband's also a chiropractor, Dr. Neely, have suffered from wrist issues because we adjust people all day long. We use our hands quite a bit. And both of us were really amazed how much this simple brace helped us. And the reason that it's helpful is that when you're building tension in your wrist all day long, when you go to sleep at night, you don't even realize it, but you crunch your hands in like this. And when you crunch your hands in like this and you wake up, like now your wrist is really sore. So all this simple brace is doing is it's keeping the thumb and the wrist aligned while you're sleeping. The thing we like about it is it's super comfortable. We were both very amazed that it didn't wake us up at all. And, he's got much larger hands than I do, and yet this brace seems to work for all different hand sizes. So that's great as well. So we keep it around. It's not something we wear every day, but certainly if you've had a long day and your wrist's starting to ache and you don't want that to get away on you, I really recommend trying this brace. I'll link it in the description below, and I'll just show you this quickly. It's very, very easy to put on, as you can see. Super comfortable. Very easy to adjust with the Velcro. And I really highly recommend if you've suffered with chronic wrist pain that this is just a nice little extra thing to have to help you along your healing journey. I really hope that that was helpful to you. If you have any other questions about your wrist or anything else, please leave it in the comments below. And other than that, if you found this video helpful, I'd really appreciate it if you'd subscribe and like it. And that allows us to bring you many more videos. So have a wonderful day.